A hearty welcome to my channel Kunjappan Sebastian. Today our topic is complications of diabetes part 1. Diabetes is a condition in which the blood sugar levels are equal to or more than 200 mg per dl compared to the normal blood sugar of 70 to 140 milligram per dl. As this blood with higher sugar content circulates through all parts of the body. Complications of diabetes adversely affect the entire body. Hypoglycemia is the most common complication seen in diabetics when the blood sugar goes below 70 milligram per dl. Hypoglycemia occurs because of three reasons. The first reason is vigorous physical activity or strenuous exercise. Secondly, the excessive use of anti-diabetic medications or insulin. The third reason is undue delay in taking food in time. Doctors advise diabetics to avoid these situations to keep away from hypoglycemia. It is important that all diabetics are aware of the symptoms of hypoglycemia like anxiety, drunken feeling, blurred vision, cold sweats, confusion, difficulty in concentration, fast heartbeats, drowsiness, headache, and nervousness. Hypoglycemia is an emergency situation and calls for urgent action to prevent the person going into coma. As a first aid, the person may consume 4 teaspoons of glucose or sugar. After 15 minutes, the blood sugar is to be checked and if found less than 70 mg per dl, another 4 teaspoons of glucose or sugar is to be consumed to make sure that the blood sugar is more than 70 mg per dl. In case the person becomes unconscious, urgent medical aid is to be sought as glucose cannot be given orally. In this situation, doctors generally administer an injection of glucagon as an antidote. The blood of a diabetic person having higher levels of sugar may exert more than normal force on heart and arteries. Blood pressure is the pressure created by blood on the walls of the blood vessels. High blood pressure or hypertension damages the blood vessels, especially when the blood of a diabetic person, apart from levels of sugar, contains fat and cholesterol. When the blood contains fat and cholesterol, they together with sugar, the blood becomes thicker and stickier and forms clots on the inside of the damaged parts of the blood vessels. With the passage of time, these clots grow in size and block the blood vessels, causing heart attack and stroke. It is estimated that majority of diabetics die of heart diseases. Kidney is another important organ adversely affected by diabetes. The function of kidney is filtration of impure blood and elimination of impurities in blood through urine. The filtration of thick and sticky impure blood containing sugar, fat, cholesterol and salt puts additional burden on kidney. In the long run, the efficiency of the kidney drops and requires regular dialysis. Unfortunately, it may so happen that the kidney fails and calls for urgent kidney transplant. High levels of blood sugar damages the tiny capillaries of retina, resulting in diabetic retinopathy and loss of vision. Persons with diabetes are more prone to the cataract, a condition of the lens of the eye becoming cloudy, resulting in blurred vision. Another complication is the increase in fluid pressure inside the eyeballs, called glaucoma. Of all the complications of diabetes, the most worrying and upsetting one is blindness. In the next episode, complications of diabetics part 2 shall be presented before you. Hope you find this presentation useful. Please like and subscribe to my channel. Thanks for watching.